Tonight, we're taking you to the front lines of Connecticut's heroin crisis. The numbers are staggering. Heroin arrests, overdoses, and deaths are rising at an alarming rate all over the state of Connecticut. News 8's chief investigative reporter David Iversen traveled across the state for this report.
Darren and Ann, we teamed up with the New Haven Register for a month-long comprehensive investigation into the impact heroin is having on Connecticut. The number of heroin deaths in our state has almost doubled in the past 3 years, and nowhere is the problem worse than in Litchfield County, which is where our story begins. Garrett Duderman wouldn't have a job at Torrington's Charlotte Hungerford Hospital if it wasn't for heroin.
I work specifically with people who are addicted to opiates.
Duderman's job is partly funded by the state. It is the first and only job in Connecticut created specifically to deal with a growing number of heroin-related overdoses. It all keeps him pretty busy.
It's frustrating only because the system's pretty broken.
The broken system is where Duderman comes in. After a heroin addict comes to the hospital, usually from an overdose, it's his job to help that person get into treatment.
I had to call and I had to sit with patients, and by going with them as far as I could in that whole process is how I became aware of how this is for them.
He says it's not easy for an addict to get detox treatment, even if they want to.
Across the state, there's less than 200 beds on a given day. And we were talking that, fatalities are in the 300s, 400s, 500s of drug-related, deaths. So if that's how many people die in a year, and there's only 300 beds, it's pretty clear that there's a problem with the number of beds.
News 8 discovered Litchfield County, along with New London County, lead the state in heroin-related arrests and overdose deaths. That means that here, in the state's most rural county, there are a lot of people seeking help. Duderman routinely calls the same 8 detox facilities for his patients. None are located in Litchfield County. Hi, I'm wondering if you have any detox beds available. Do you have any detox beds available? I'm wondering if you have any detox beds available. We wanted to check it out for ourselves when we called 2 detox centers, referred us across state lines to get treatment to Worcester, Massachusetts. Do you guys offer any type of way to get there? Okay. And are you guys willing to hold a bed? You guys won't, okay. Even if you can find an open bed and they're willing to take your form of insurance, treatment centers often are not able to help you get there.
We're playing a game. The better you know the rules, the further you can get along in the system. Unfortunately, the game kind of sucks.
The game, as Duderman calls it, could soon get harder. Governor Malloy's budget plan cuts funding for the Department of Mental Health and Addiction Services by $10 million, with over $1.2 million being cut from the Substance Abuse Services. It will also close a 20-bed detox facility in Middletown. The governor disagrees that his cuts will directly affect heroin addicts seeking treatment.
I think you're missing the point. We're spending more money than we've spent in the past overall. Any one program may shift depending on who's using it.
These suggested cuts come even as members of his own party go as far as to call heroin use in the state an epidemic.
From little small towns like Canaan and Salisbury to Torrington, where we are here today, to Hartford, it's an epidemic that knows no boundaries.
Congresswoman Elizabeth Etzy attended Litchfield County's opiate task force meeting this month. The task force has hoped that Duderman's flagship position in their community would inspire other hospitals around the state to follow suit, but proposed budget cuts make that seem unlikely anytime soon.
It feels everybody, whether you're aware of it. We're in this together. This is our community.
On our website, you'll find even more on this crisis. Head over to the Investigators tab on WTNH.com. You'll find links to our findings and the work of New Haven Register reporters. David Iversen reporting for the News 8 Investigators.
If you have something you think needs to be investigated, just call the News 8 Investigators tip line. That's the number there, 203-402-TIP-8.